Welcome to the latest printed press and our COVID-19 platform special. Once again, we've got some amazing people from the community talking with us today about all the developments of the COVID-19 platform group. So we have Dr Mekella Mehmet Yesil with us, Jansev Djemal, Ulas Tozun, who is the head teacher of the Dr Fazil Kucuk Turkish schools, and Erim Metto, CEO of the TCCA. Welcome everybody to the program. Thank you very much for coming on.
Hi.
How are you feeling?
Hi.
Hi.
Hi, everyone.
Welcome, welcome. Like I said, we have this on a weekly basis, the COVID-19 platform group program. And what I want to do first of all at the beginning is just have a little bit of a summary from Erim about where we're at, because we're sort of coming to a bit of a shutdown with it, closed down, and sort of changing our ways as we come out of the lockdown until our new normal, so to speak. So if Erim could just give us a bit of an update as to what's been going on this week.
Yeah, as most people know, that we've been running this program on a weekly basis since the 18th of March. The current situation is that as we move towards the end of lockdown, that we're finding that the pressures placed on us as a community are becoming less and less, although the pressures are still there, but we need to think of a new way of actually operating. So the idea is that we're going to be working on our project until the end of July. So I think the last day of July is the definitive date that we'll actually stop doing food runs and so forth. Thereafter, we're going to be shifting emphasis to continuing to complete the befriending project aspect of this project. And what we're going to be doing is we're going to be looking to fill the gaps for those who really in need. So there are still people who are isolated, and how we're going to be dealing with them. Do they need to be put into the care system? Do individuals need other organisations to pick up the slack and support them? So the aim is now we're working towards coming to it. And I think what we've discussed as well is next week will be our final programme of the COVID-19 support group. And the idea next week will be that we would give out information related to if services are needed, where to go, who can help, including us as TCCA, because TCCA now will be open as an organisation, so we'll be open as a centre, is providing the information and advice that people need. So the centre will be open to the public from I think it's from the 6th of July, which is a Monday. So in essence, we're changing the way we operate. We're not saying that there's not an issue. There are issues, but they're different to what they were 6-8 weeks ago. Yeah. So that's where we're at the moment.
Yeah. So there's good news there. Obviously, with most places things are opening up. So obviously, you know, the need is going to slightly change. But obviously, we're going to do one program. Yes.
Yeah. I think the other thing is that we need to bear in mind is that we've been quite fortunate in the initiative that a lot of people that have been able to help us have been on furlough, so they've had time to come in and jump on board and support us as an organisation. I know some other individuals are just coming on furlough now, but most of the people who helped us have been on furlough. Most people are actually going back to work now. So most of the volunteers that we have who do the food runs, who kind of work with us as an organisation, are having to go back to their normal lives, and we are having to accommodate that change as well. And also the funding that's been available for us to support the food runs is also lower than it was, obviously. So we need to look for additional funding, or we need to refocus what we're doing.
Yeah, but as always, wherever the need is, I'm sure the TCCA will be there. And I think the way we're thinking now, like, you know, throughout all of these weeks when we've been doing these programs, what's very apparent is the fact that, you know, these volunteers, even though maybe they're not going to be on furlough, they're going to be going back to work, are all willing to help out in some which way. So I think our way of thinking has definitely evolved, which is good news. So wherever the need is, I think we'll be able to, you know, spread our wings wide. Mekella, can you tell us a little bit about yourselves? I think we're going to go around now and introduce ourselves to the audience. I mean, all of you are very well-known people in the community, but just for our audience purposes and for the program, if you could just tell us a little bit about yourself.
Right, obviously you know who I am. I'm Dr Mekella Mehmet Yesil. I'm a researcher scientist. I'm heavily involved in research within the Turkish community, MS, obviously with the coronavirus as well now, and obviously disparities in the healthcare system. So I'm the founder of Health Screen UK. I do a lot of volunteering work as well. I work with various hospitals in the country, mainly around London. Many projects that get advocated to me, I sort of take them on board, and I do research within those communities or groups, shall we say, whether it be cancer or other sort of genetic illnesses. So that's where my forte is, basically medical research, and that's what I'm renowned for.
Okay. Yes, and your programs as well have been very informative. We've had
I've had a few of them. I've had quite a few this year. Yeah, about 8 of them.
Successful. Thank you very much. And I know that your charity is part of the quiz as well. So obviously you're helping the community in lots of ways. Forming lots of links with You're Against TV. So thank you very much for all that hard work, Mekella. I mean, and like I said before, just before the program, you were one of the last programs I had in the studio, and you made lots of about what was about to take place. And I think
it happened.
It happened. So, I mean, at the end of the program, we'll talk about that, where you think we're going to go. And I think from a scientific perspective, I think that's very useful for our audiences.
Definitely.
What you've got to say. Jansev, first of all, thank you very much for coming on my program. Congratulations for winning your round of the quiz. Well done.
Well done.
Yay.
So congratulations on that. How are you today?
Yeah, I'm good, thanks. As I was explaining to you earlier, I've been a bit unwell with a bit of food poisoning since the win. Apart from that, I'm fine.
Oh, awesome. Can you tell our audiences? I mean, obviously, we had a one-to-one program as part of my Young Professionals series, and you actually were very inspiring to our audiences anyway. But if you could just quickly summarize your background for today.
Yep, so I work in social research. I studied politics, work in social research now, and I was a local councillor for 4 years in Enfield between 2014 and 2018, so used to doing sort of a lot of stuff in the wider community. And in my case recently, I was furloughed about 2-3 weeks ago. So once that happened, I was like, right, okay, what can I, what opportunities are there for me to get involved and help out? And I saw that the TCCA had put out, when they were sort of putting out one of their communications about the stuff that they've been doing, that if people were interested in getting involved, to drop them a message. So I did, and I've been helping out with the food runs over the last couple of weeks. And I'll be going back to work in July, but on a 4-day week basis. And hoping to sort of continue helping out in some way, shape or form in the community going forward, because I found the experience hugely rewarding, and I'm in awe of the people that I've met through the process. That they do such an amazing job. It's been brilliant to be with them, even if it's just been for just a short time.
Yeah, thank you very much for all your experience, and I think definitely we will have you again on our program as well, because I'm very interested in the research part. I think that's very important for our community as well. Going forward, that we do a lot more research, and we, sort of find out about what certain things are happening in the community and use that information for our benefit. And I think you're going to be one of those key players, Jansev, for that. So thank you, and thank you for all the work that you've done. Anyway, and also for being such an inspiring Turkish Cypriot woman, and so intelligent, and winning the quiz last week.
What can I say? I'm honoured to be on with you and Dr Mekella, who are also amazing, Turkish Cypriot women in the community. So
definitely. That's great. Tell us a little bit about yourself. You're the head teacher of the Dr Fazil Kucuk Turkish School.
Öncelikle ben Türkçe konuşacağım. Tabii sizler için de tamamsa. Daha kolay kendimi ifade edebilirim o yönde. 12 yıl var Londra'dayım. Kıbrıs'ta büyüdüm. Burada Business Management and Law bilgisini tamamladım. Ardından Kıbrıs'a döndüm. Fakat 1,5 sene kalıp tekrar geri Londra'ya yerleştim. Yaklaşık 6 yıl var Londra'dayım. 4 yıl var Dr Fazil Kucuk Okulu'nda halk dansları öğretmenliği yapıyorum. Ayrıca tabii ki bu sadece cumartesi günleridir. Hafta içerisinde özel bir sektörde müdür yardımcısı olarak çalışmaktayım. Arkadaşın da dediği gibi bu Covid'den dolayı tabii ki şu anda furlough olduk biz de. Evden de çalışamıyoruz food retail olduğu için. Son 5 senedir de Dr Fazil Kucuk Türk Okulu Yönetim Kurulu'nda as başkan olarak diyelim. Sultan Hanım'dır asıl okul başkanımız. Birlikte çalışıyoruz. Çok güzel bir ekibimiz var. Eylül'de devraldık biz okulumuzu. Fakat dediğim gibi o da Şubat'a kadar sürebildi. Bu yine Covid'den dolayı okulu kapatmak zorunda kaldık. Önceliğimiz eğitim, öğrencilere elçiliklerimiz tarafından faydalanan, desteklenen öğretmenler elçiliğinde Türkçe derslerimizi veriyoruz. Halk dansları, kültür dersleri veriyoruz. Bunun yanında bu dönemde düşündük toplumumuza nasıl yardımcı olabiliriz diye. Bu bağlamda bazı projeler gerçekleşti ve bunlarda da biz de bir destek, bir küçük destek de biz olmak istedik. Ve çok güzel işler başardık. Bir diğer soruda herhalde bunu daha detaylı açıklayacağım. Hepinize iyi yayınlar dilerim. Teşekkürler bu arada davet ettiğiniz için okulumuz adına selamlarını da iletiyorum.
I'll just briefly try and translate that to our audiences. Obviously, Ulas Bey is the deputy head teacher of the Turkish school. And what he's saying is obviously during these times, he's been furloughed to stay at home. But obviously, the Turkish school's main aim is to educate its children. And there's been a number of projects during the Covid-19 that has taken place so that the school can, carry on running and can help the community. But Ulas Bey went back to Cyprus for a few years, but then returned to England, and it has been here since. So he's going to be speaking to us in Turkish, but I can translate as of when is needed. Erim, can you just give us a little bit of a summary? Because I'm going to go around now and talk to everybody about what everyone's been doing, but just generally from the beginning weeks in March, when this all started to now, it's been quite a long journey, hasn't it?
It has. I mean, if you think about it, the first phone call that we received as an organisation was someone mailed on Facebook saying there's an elderly person, there's lockdown, she can't get out to get food. We took it upon ourselves to go and get food, and we thought there must be loads of other people out in the community. We had the Turkish Community Philanthropic Association contact us with a list of 12, and there's other organisations came forward to us with other people. So we then opened up our arms and said to individuals in our community, can you come and help and can you volunteer? We'll try and sort out the food packages. We'll try and sort out sourcing the food. And then things fell into place. I mean, we had Gülay and Sultan who took the lead in organising the elements of our volunteers. We were fortunate to get some smaller grants through and some donations through to help us with the food. We had some amazing people and some amazing organisations like Edible London who were donating food packages, and the mosques as well during the period of Ramadan were delivering hot meals, amazing hot meals from the various jammies in London, particularly the one in Edmonton. And so the community really came together. Now, we hit our peak about 2-3 weeks ago where we served, I think it's close to 500 meals in 1 week, and we did it in a region of about 150 packages in 1 week. We're now going right the way down. I think the estimation for deliveries for this Friday, packages that we're doing, shopping packages, will be about 70, 80. So we are heading in a downwards kind of roll, and we're trying to look at the people which really need it and the ones that don't. So everyone's making those decisions, and the closer we get to the end date, the more in-depth stuff we're going to have to do to ensure that people are not left isolated. So we don't just say we're going to end on the 31st of July and then no food, no help, and it's totally lost. We want to ensure that there is some sort of handover to other systems that can move forward for it. We're also with an amazing group of people wanting to kind of develop and deliver new things. So hence the quiz came about. We thought, how can we showcase the amazing talent we have within the Turkish Cypriot community? People can find out about these amazing charities like Charter, Cyprus Islamic Association, and also find out what amazing people we have in the community. And hence all these people have come about and volunteered to become members or contestants within the quiz. I mean, Jansev had, she's got, she's been working in research. She's been a local authority councillor. She's come on as a contestant. Fevzi is one of the founding members of Embargo, amazing person, totally dedicated his life to the community. All the other people which are going to come up in future shows and so forth have all been really, I mean, Bayram Chubuk, who was the young man who was there yesterday's show, who came quite close but not close enough. He's quite keen in the Football Federation, and one is aspiring young people in our community who's going to shine through in the future. So it's hence of bringing people together, looking at ways we can showcase the amazing skills we have and try to work as a whole community, recognizing that we all have different, we have all different preferentiations. We all like different things in life. We might support different political parties, but we are one community at the end of the day.
That's right.
So we're trying to instill that community feel in our community and try and support each other.
I think that's very important, and you're one of the key leaders that's been able to do that, bring the community together. So thank you very much, Erim, for that as well. I think it's been vital during these pandemic times, in emergency times, that we can pull together. And I think as a community, we've done very well. Obviously, there are pockets of issues, but I think as we move forward now, we've grown more together, the groups have merged together. And like you said, yes, we may not be able to provide the same provision, but the provision will still be there through these separate groups. And it's great that you're doing the quiz and everything to introduce these individuals, if people haven't seen them that often, to the community again, just to remind people of what these different groups do, because they were fully functioning way before the COVID-19.
Yeah, most definitely.
And that's another point that we need to make to our audiences, because I think that was sort of raised last week when we were talking to some of the leaders of these groups. It's something that doesn't happen once a year at Christmas or once a year at Bayram or just during COVID-19. It's something that's continually happening. Obviously, we had to change tactics during COVID-19 because we were housebound and, you know, we needed volunteer groups, etc. Hence why we did this program. But I think it's important to say that this has been something that's been running for a long, long time. Mekella, can you tell us what you personally have done for the...
Have I done? Right, sure, yeah. Well, what I was doing was, there was 3 elderly couples which I was looking after that were shielding. They obviously had like kidney transplants, cancer, stroke, so they had to not quarantine, but they had to be shielded for much longer than the normal like 3-month lockdown. So they started shielding from the beginning of March. I already knew about those people, so what we had to do was make sure that they had their medication. They were actually discharged from hospital and put back into their homes, obviously not care homes, but in their own homes. But they needed their medication, like stuff for their chemo and stuff, regular medication, anti-sickness drugs. So I was doing like runs for that. I was doing the food runs as well with Erim once or twice, helped out there. One of them was in Tottenham, one was in Chigwell, one was in Enfield. So there was a few of them. So picking up medication, doing the food, doing the buddying, chaperoning them if I had to go anywhere. So just stuff like that.
You've done the chaperoning as well. That's really
lovely. Yeah, do chaperoning, like take them to UCLH to get their chemo done every sort of like 6 weeks, because and obviously do the testing as well. That was another thing, because what was happening was some of the PCR testing didn't actually get done until later on, towards the end of April, and by then a lot of people had already contracted the virus. So what was happening was we had carers, what Erim will tell you, or people, some of their people that they look after in the community who contracted the virus but weren't being able to be tested. So we had to, luckily we had a good investor who came in and said, look, I'll pay X amount of money into your charity, buy the test. So we bought the test and we tested the carers, the patients. So we're able to sort of get down to the bottom of what was going on. So it's quite good. And this is all over London, South London, Stoke Newington, Hackney. I think one was in Dalston. So just going all over the place, testing people.
Okay,
and nurses.
There were centres that the carers would go to, or you would go to them. How did that work?
Either way, it depends where they were, because we wanted to eliminate contamination and we wanted to limit communication and obviously interaction.
I think the situation is that you have a certain degree of a fear. If someone has a cold and that sort of thing, you don't want to restrict care to that individual. So the easiest way to deal with it, to ascertain whether it is COVID-19 or not, is to have a test. And Met was putting herself at risk, going to various clients and to ensure that tests were carried out so that care could carry on. And also some of the individuals which were working with us and providing the support for runs and stuff were also tested because they had certain fears and stuff. So Met came on board and did all that for us.
That's fantastic. Thank you so much. Don't get talked about, and it's very important. And it is important for the key worker to be tested as well.
We did. We tested nurses as well.
Because I know as a key worker, I think I need to be tested too. I mean, I've been going into work once a week at the moment. We're in like our bubbles for teaching, so I go in once a week, and we're limited to 15 students in one time. So it's very structured and very well planned at the moment. But obviously, as things start opening up, things will develop. I think schools won't change now until September. So whatever plans have been put into place, I think we've got our year 10s in, and then key worker children. So we're running 2 schools at one time, which has never been done before. It's like a new system. It's never been done in this country or anywhere before. So obviously our normal is a new normal for sure. So I think we are going to still need to adapt, even though we're coming out of lockdown, and we're going to talk about your concerns about the future around October, November time, and warnings that I think are very important for the public for you to inform us about what you think. Jansev, tell us about the support. I mean, I see you on the Friday food runs the last couple of weeks, which has been excellent. So we've gotten to know each other firsthand, which has been great, as well as being part of the program. But if you could just tell our audiences the things that you've been doing as well during these times.
Yeah, sure. So, I mean, as you've just said, I had been working sort of full time up until a few weeks ago. So I wasn't able to do very much initially, but once I was on furlough, I sort of got in touch, and I've been helping out with the food runs, and week 1 I ended up going off to East London, and last week offered to go to cover the southeast, which was a great experience for me, but it was so brilliant just to sort of meet the older people that we were distributing the food to. I think a number of the people that I've been to live on their own, and so it's really, the service that's been provided to them has been absolutely critical, both in terms of the food, but having that little bit of human contact each week, somebody to say hello to, and just say, how's your day going, how are you doing? So yeah, it's been so rewarding from that perspective, and like I said, it's been amazing to also to see the operation that's gone on behind the scenes to get all of that in place. I mean, it's quite spectacular. And as I said, I'm in awe of the whole team who've been doing that from sort of the get-go. So yeah, it's been such a pleasure for me to get to sort of know them over the last couple of weeks and to be able to help out a little bit. It's been brilliant.
Yeah, definitely. I'm sure, I mean, like Erim was saying, obviously we're all going back to work, but you were saying even before the program, although you're going back 4 days a week, you're still going to have some time. So I'm sure, like, we think differently now, don't we? About what we're doing. And I think that's the message as well that we're giving to our audiences today, is that the fact that we are going back to a little bit of a normal, but it's a new normal. Certainly slightly different from before. Ulas Bey, siz de bize söyleyebilir misiniz? Yani bu Covid zamanlarda ne yaptınız izleyicilerimize?
Tabii ki söyleyelim. Dediğim gibi bildiğiniz gibi okullarımız kapandığından dolayı, tabii ki bu arada bunu da söylemek isterim başlamadan Covid ile ilgili. Konsorsiyumun sayesinde sağlanan bizim online Türkçe derslerimiz devam etmektedir. Evet. Cumartesi bütün öğrencilerimize online platformda ulaşıyoruz. Eğitimlerine devam ediyoruz. Bu da toplumumuz için, buradaki toplum için bence büyük bir gururdur. Buradan aracı olan herkese teşekkür ediyoruz Nuriye Hanım başkanlığında. Covid-19 döneminde benim eşim de Kıbrıs Mühendisler Birliği'de yönetim kurulu üyesidir. Kıbrıs Mühendisler Birliği bir bütçe hazırladığını söyledi. Ve bu bütçeyle yardıma ihtiyaç durumda olan insanlarımıza bir şeyler hazırlamak istediklerini paylaştılar. Biz de Dr Fazil Küçük Türk Okulu olarak bu bütçenin dağıtım ayağı olabileceğimizi söyledik. Ve ailelere yetişecek, bir ay yetişecek olan paketler hazırlattık. Ve yaklaşık 100 aileye bunları okulumuz yönetim kurulu üyelerimiz tarafından gerek Kuzey Londra'da, gerek Güney Londra'da, gerekse Londra dışında olmak üzere birçok aileye dağıttık, dağıtımını yaptık ve aslında gurur duydum. Çünkü kendimle tabii ki ve ekibimizle ve bu işe tabii ki başka kurum ve kuruluşlar da yapıyor. Çünkü o insanların tabii ki ihtiyaçları vardı ama çoğu evde yalnız yaşayan, yalnız kalan, günlerdir biriyle konuşmayan ve gittiğimizde sohbete muhtaç insanlarımız vardı ve biz her gittiğimiz kapıda gerek yaşlı olsun, gerek ihtiyaçlı insanlarımız olsun en az 10-15 dakika uzaktan tabii ki mesafeyi koruyarak sohbet ederek bu işlemi tamamladık. Tabii ki Covid-19'un bize bir sürü götürüleri oldu herkesten. Ama bize iyi tarafından bakarsak kazançları da oldu. İşte Erim abiyle tanıştık, Münevver Hanım'la tanıştık ve onların halbuki bu işleri çok daha önceden ne güzel ilerlettiklerini gördük. Ve bizim o sınırlı olan bütçe tamamlandıktan sonra TCCA'ya TCCA ile beraber bu dağıtımları yapmaya başladık ve güney ayağı olduk. Tabii ki daha farklı dağıtan insanlarımız da Jansev arkadaşımız gibi, Gül arkadaşımız gibi dağıtan insanlar da oldu güneye ama biz de elimizden geldiğince 4 hafta var. Bu yardımları ihtiyaçlı olan insanlara ulaştırmaya çalışıyoruz. Bir nebze olsun bir katkı sağlanıyor. O insanlar mutlu oluyor. Tabii ki bütün ihtiyaçlarını karşılayacak durumda değiliz. Kimse değil. Fakat küçük bir yardım bile o insanların mutluluğuna yetti ve bunun bir parçası olmak benim için çok güzel bir duyguydu. Kıbrıs'ta sürekli görüyorduk biz bunlar tabii çocukluğumuzdan beri bu birlik beraberliği ama burada da bunu yaşamak bence çok güzeldi. O yüzden tekrardan bu işleri başlatan herkese teşekkürler. Öncelikle Erim abiye tabii ki.
Evet, tabii ki ama biz de size çok teşekkür ederiz. Bunları yaptınız. I'll just try and translate that quickly. Basically, obviously, the Dr. Fazil Kucuk Turkish School has been delivering online lessons throughout the whole time of COVID-19. As most of the Turkish schools have done, it's been great that the pupils haven't missed out, that they've been able to access online lessons. So that's been a huge help for our youngsters, kept them going with their learning and obviously enthused them and engaged them with other students, with their teachers. So a big thank you for carrying that on. Also, funding was put into place so that the Dr. Fazil Kucuk School could actually do some food runs as well. And they liaise with the Conseil, with Erim, Metto, with the TCCA, and also Chutter groups, and they've been delivering to North and South London as well. And Ulas Bey was being very modest, saying that, you know, even if it is a little bit of help, it's something, but actually it's big help. It's you know, it makes a huge difference. Of course, it's not going to, you know, we can't be able to, you know, give out to everybody everything that they need, but even that little bit of help on a weekly basis, I think makes a difference, especially to those, like he was saying, who are vulnerable. Not only is it that you're giving them food packages, but you're going there and from a distance, obviously, you know, practicing social distancing. He said outdoor, you would spend 15 minutes having a chat because a lot of these people are alone, they're vulnerable, they're elderly, and they're feeling, you know, scared and alone. And, you know, we all had, I had times where I felt very depressed and alone. Obviously, we all had moments like that. And especially if you're vulnerable and you can't get out and do things for yourself, then you're going to feel like that. So I think it's made a huge difference. So thank you very much for doing these things. And it's great to hear how all these different groups have come together and helped each other. We've got lots of different comments. We've got comments from Gulfidan, who is one of our volunteers, and she's given us clap hands. Also, Naima Kale has said, another wonderful set of guests. Hello to you all, amazing people. Naima has been on my program. She's an NHS care worker, so she is amazing herself, and also does lots of discussion groups and forums on different platforms as well on Facebook of late. So thank you very much for all the things that she's been doing. Yeliz is saying fantastic work, Erim and everyone. Hello, great show. Also Mehdi Ismet, all the way from Cyprus, has said hello everyone, great show. And Ferda has put Ulas a heart, obviously somebody that you know, Ulas.
My mother-in-law.
My mother-in-law.
It's your mother-in-law. We are like your heart.
From
That's a bonus. You're in a good then. I'd keep that up. Ulas.
Yeah.
When it comes to the mother-in-law, our heart is good.
Yeah.
Everybody says hello as well. Yeah, definitely. My mother-in-law watches this program as well, but she's not quite au fait with the comments yet. She like writes all in one go. So it's all like blah, blah, blah, blah. She does watch it. I think we have got quite a big fan base now. Bayram Çubuk, who is a very clever man, part of our quiz last night. Hayırlı yayınlar arkadaşlar ve sevgili Erim Bey'imiz. Very good at the Turkish one. He's basically saying good broadcasting, love to all, especially Erim Metto is giving you the most love, Erim. So,
you got one as well, Erim abi.
You know, you started to be called Bey and Abicim and Sir, so you know, getting old.
That was very important to us. I think it's not so much you're getting old, it's because you're important to us. on that side. And Belin has just said, fantastic work, everybody, as well. Erim, so next steps. Obviously, I think our program next week will be focusing on how we're going to be tying this all together. But
Yeah,
just up to people, what are the next steps?
I mean, in lots of different areas, we've built strong partnerships that are foundations for our community to be able to move together as a whole and to support each other. Foundations that relate to the platforms that we use, like Eurogainst, TCCA UK, and the other platforms that have been created over this period of time. The other partnerships relate to the services that we provide, and recognizing that we all have individual skills which, when they're brought together, can become amazing clogs in this whole community work that we do. So groups like Ulas, who runs a fantastic group in South London, and the various volunteers they have there dealing with South London, us in North London, that's just one example of a partnership that works. And it's just been recognizing that we're all different organization, we all have different skills, and how can we make all those skills come together so the community as a whole benefits, and we don't have to, you know, bring each other down, we don't have to go into competition. As a unified force, we are very, very strong as a community, and I think that my emphasis will be to try and build on that. We found the foundations of it here during COVID-19. It's one of the positives that's come out of this, and we found the foundations of who we are as a community, and I think we just need to move forward with us working as one and respecting each other and being able to say that we are amazing people, we are amazing individuals, and we don't bring each other down. So that will be my starting point for this.
Definitely, I think that's really important. I know we keep saying this, but it's so important because people listen. Quite listen. I will say this openly, even on the program, but really we need to get people go. It's not just about emergency times, but it's about moving forward in the future as well, and thinking as a whole community, because we're not going to be strong just on our own, but an organization. I think that was pointed out to us very much so last week by one of the community leaders when they said, you know, I think it was Munavera, she said, you know, it's not about just being an individual. No organization can run on its own. You need to spread your wings and branch out and get assistance from other people, because everybody has their specialisms and expertise. You need to utilize that to become stronger and move forward. And she actually even gave examples from Turkey, how during earthquake crises, how these organizations came together, and then in the future they worked together and they became more successful and bigger as community groups. So I think we need to take heed of this, and certainly as our Cypriot community actually move forward with this in mind. Mekella, tell us, I mean, we're sort of closing up our program now. We've actually gone over, but we've got 5 minutes. What would be your message to our audience for the future?
For the future, well, I can say to you now, the virus is not going to go away anytime soon. It's still here. We may have the warm weather, which keeps it suppressed, but come sort of like September, October, November, when people start becoming what they say the norm, back to normality, it's not going to be normal for a very long time. Give it another year, 18 months. We're going to be living with the social distancing. Face masks would be a norm until the government tell us, or the science tells us, you don't need to wear it anymore, and until a vaccine becomes available, which can be anything up to 2 years. And usually with vaccines anyway, when they're trial from start to finish can take up to 10 years. This is a new virus. It's only been around for a few months, so we're still learning. On my Facebook page, I've become a mentor on a thing called the Covid-19 exchange platform, where I'm involved with many scientists around the world from all areas. And basically, whatever new information comes to light, we're sharing that on our Facebook page or on the exchange. So whenever there's new evidence that comes to light, we share it. So if anyone wants to join us on that, by all means, we do that from a medical or scientific background, by all means come on board and give that information, share information. I've actually written and published a paper, which has taken me 4 months, and luckily Erim Metto has overseen that paper for me. I've written it with my professor Ian Hale, who's overlooked it for me, and he said that what I've written is fantastic, it's brilliant, and it's obviously a way of moving forward. I just want to touch on something you mentioned earlier about anxiety. You said you've got a bit of anxiety because of everything that was going on. The problem isn't going to be now, tomorrow, or next week, or next month. The problems are going to occur a year to 18 months, maybe 2 years from now. We're going to see a lot of people, elderly as well, where they've been subjected to this quarantine period, 3 months, what have you. It's going to have what we call a post-traumatic stress disorder. So we're going to have to be there for our elders, for our loved ones, for the people next to us. people who are not able to express themselves, people who are afraid to ask for help. Those are the ones that are more vulnerable. So we have to be open, we have to be honest, and we be able to direct those people through the right channels to sort of get help, because it's not now, it's in the future. It's not hit us now. At the moment, we're thinking, hey, this virus is gone. We're going to be okay. We're going to get back to normality. There's no such thing as normality, not until we have a vaccine. So just bear that in mind. And obviously the social distancing, that's going to change 1 meter from 2 meters from next week. But we still have to practice the good hygiene, limiting contact with people. And obviously, if you do feel well, quarantine yourself. That's another thing. So and don't be afraid to take your paracetamol or your ibuprofen, because the research says it helps. So taking the ibuprofen and the paracetamol has proved that doctors are saying it's okay to take it. And there's a government advert on there on the TV now.
About that, Mekella. So what, on a regular basis, even if you're feeling
no, if you do feel poorly and you feel you've got like a flu symptom coming on or a high temperature, it is okay to take the ibuprofen or the paracetamol. Obviously, if you've got any side effects or allergies, don't take it. Consult your GP or your doctor, but it is okay to take it.
Brilliant. Thank you very much for all of that advice. I think we need to take heed. It isn't quite over. Yes, we are coming out of the quarantine a little bit, but we still need to be careful. And like you said, psychologically as well, 100%. I had extreme high anxiety when I first went back to school a couple of weeks ago. But as I'm getting used to it, I'm feeling positive. I'm trying to take one day at a time, trying to stay positive. And I'm not a vulnerable person. I wouldn't say I'm vulnerable. You know, I've got people around me. I'm quite well informed, and you know, I'm able to get out and about. So certainly, if you have members of your family or friends that are vulnerable, keep an eye on them. There's been lots of cases I know from my friends and family where people haven't just passed away because of COVID-19, but because they've had anxiety and lots of other things have happened. Some terrible tragedies happened over this time. So we must be careful, and we must, like you said, be open to help.
Exactly. You know, and sometimes it's the people who, just like yourself and me, who may not be able to talk about certain things and may need that little push to just help them, to guide them, because a lot of people will have anxiety after this, and we're not going to see it now. We're going to see it months down the line, a year down the line. Definitely.
Thank you for that. Very, very good.
That's all right.
Advice. Thanks. And I think you need to come back on the program, or I think we have a separate one.
That's all right. That's all right. No worries.
For sure.
Anytime. Anytime, no problem. I don't mind.
Very informative as well. Very fantastic. Hopefully, we'll see more of that as well. And I look forward to reading your paper and all your research. And good luck, obviously, with the quiz as well, because I know it's part of your charity as well that's organised it. So thank you very much for that as well. All for a very good cause. Jansev, what's your message for the future? Because when you were on my program a couple of weeks ago, some of the things you said were great suggestions. I've taken some of them on board.
Look, it's very difficult for me to sort of set up, because as I said to you that night on the program, I think the way that the community is pulled together has been absolutely brilliant, and I want to say a big thank you, take this opportunity to say a big thank you to the likes of Erim and all of the other organisations that have come together to put in place structures that have given the volunteers the will is there to help. But it's needed people to put in place the structures to be able to do and achieve the things that they've achieved. But also the media platforms like Eurogench, like Facebook groups like TCC, TCC UK. They've been brilliant, and they've helped me. I know that they've helped me to feel closer to the community again, and I'm sure that, you know, if it's helped me, it's helping others as well. And so my big message to everybody is let's keep the bond we've established now together, and let's not sort of let it dissipate after all this is over.
I think so, definitely. All great stuff. I agree with you wholeheartedly. Ulaş Bey, son mesajınız var mı izleyicilerimize?
Evet, iki mesajım var benim mümkünse. Birincisi ailelerimize, buradaki Türk okullarımız çok güzel işler başarıyorlar ve gönüllü olarak canla başla herkes çalışıyor. Fakat öğrencilerde gitgide azalmalar oluyor okullarımızda. Ki okullarımızda sadece dil değil, kültür derslerimiz de var, sanat derslerimiz de var. Çocuklarımıza kültürleri de öğretiyor, sanatları da öğretiliyor, ülkeleri de tanıtılıyor, liderlerimiz de tanıtılıyor ve ayrıca bu birlik, beraberlik dediğimiz olduğu küçük yaşta onlara öğretebilmemiz de sağlanıyor. Çünkü orada biz hepsimiz farklı insanlarız, fakat birlikte hareket ediyoruz. O yüzden lütfen okullarımıza geri döndüğümüzde tüm Türk okulları için Katılım yapılsın, çocuklarımız bu okullara götürülsün. Çünkü ileride bunun çok büyük faydalarını göreceklerdir. Bu birinci mesajım. İkinci mesajım da toplumumuz için siyasi olmadığı sürece farklı görüşlerden de olabiliriz. Fakat toplumumuz için birlikte çalışabiliriz. Buna hiçbir şey engel değildir. Hedef toplumsa hepimizin hedefi aynı. Bütün kurum ve kuruluşların hedefi aynı. Bu ise eğer hedefimiz, birlikte çalışmamak için excuse bulmamıza hiç gerek yoktur. Hep birlikte hareket ederek güzel şeyler başarabiliriz diye düşünüyorum.
Çok güzel mesajınız. Biraz da İngilizce buna ileteyim. First of all, Ulash Bey's got two very great messages, solid messages for the audiences. The first one is obviously to encourage parents to take our children back to the Turkish schools. It's a very good experience for our kids, for them to learn about their culture, the history. There's also a lot of different things that are entertaining for our children, like the folklore lessons and everything. So all in all, to actually have our kids attend Turkish school is a very good experience for them. So Ulash Bey is encouraging parents to continue with that so the numbers don't fall and that the numbers rise. And I think this is something that I'm very passionate about as well. I'm going to actually be doing some programs about this as well and trying to form connections and encourage parents of my generation to actually take our kids to Turkish school. So I think it's very, very important to stay in touch with our roots as well as integrate into society within this country. And also his second message was that it doesn't matter what your political viewpoint is, where you stand in society, all of us have got the same aim, and that is to help our community. So if we have the same aim, we need to, you know, all pull together and work together for that same aim. And I think that message is very strong, and I wholeheartedly 100% agree with Ulash Bey. He's got some great messages. And we've also got audiences coming in. Sultan has said, iyi yayınlar arkadaşlar, saying good broadcasting. But Bikash has said,
Bikash, she's an Indian doctor.
Oh, fantastic. All these connections. He's put fabulous speech, Dr. Mekella, so obviously in agreement with you. And also Fatima Mehmet, thanks for the advice, Dr. Mekella. I mean, yeah, it's amazing what you've said to us. Thank you very much. And like I said, I need you back on the program to inform us as we're going along, because I think it's very important. But thank you to all of you, all of your messages. I agree with wholeheartedly. You're all very strong people in our community. So thank you very much for coming on my program. Erim, any lasting things that you'd like to say before we close our program?
Well, I mean, Aysen, you've been there from day one, so you provide us with this platform that we're able to utilize to communicate with our beautiful community. So, you know, all the people that are not seen, that are behind the scenes, like yourself and Gulay, who do all the program preparation, all the WhatsApp groups, ensuring that we log on, deal with all the technical hitches beforehand, so it all goes smoothly. Although it doesn't go smoothly, but we assume it goes smoothly. But, yeah, so, you know, there's lots of people behind the scenes. There's too many people to thank, and we've probably forgotten loads of people that have helped us out. From people who've donated, like Turkish Food Centre boxes for us on a weekly basis, Mr. Butcher. There's loads of people who haven't been on this show, and there's people who we want to get on the show, but their timing's not right. So we are ending it next week. So I think the biggest thing for me is there a small regret that we're not able to thank everyone, but just know that in our hearts that everyone who has been involved, even if it's a half an hour to 30 hours a week, everyone's role in this has been equally as important, I think. Even there's been lots of counsellors and, you know, like Nessil, who's kind of been amazing, Perai in Haringey. So there's lots of counsellors who have support behind the scenes. There's loads of people that have helped out, and everyone's involvement in this has been as equally as important, in my opinion.
Yeah,
so, yeah.
Wholeheartedly, and it's sad in a way that our last program is next week, but we'll be carrying on here again.
Yeah, I mean, there'll be new things springing up all the time. Like we've got the quiz, we've got the amazing quiz. So there's lots of things coming in the future.
Girls. Well, Mekella has a good idea. Turkish Cypriot women against Turkish Cypriot men, or maybe cause an argument, and the boys versus girls might cause an even bigger argument. So I don't know. But hopefully happier days are in front of us. Yes, we have to be very careful, and like I said, we need to get you back on to give us a more in-depth sort of step-by-step summary of how we move forward. And I think your paper will be very interesting to read as well. Really, hopefully things will slightly improve and we'll be able to go back to some sort of normality. But it will be a different normality for at least
different. Yeah,
I believe
the new normality.
Definitely
the new normality.
What can you do? Such is life. We have to, you know, take it with a pinch of salt and hopefully move on. There has been a lot of tragedies within our community as well. Let's not forget. But obviously, you know, we've had quite a few, like St. Hodger and religious leaders sort of leading the way and keeping us sort of on the straight and narrow and giving us some sort of spiritual guidance through these tough times. And like you said, the anxiety might kick in. And I think the secret is not to be afraid to say it. I say it all the time when I feel anxious. I've always had anxiety. I was a school-focused child. So, you know, when
talk about it.
You need to talk about it and reach out to somebody. I think it's very, very important not to be ashamed. And I wholeheartedly will support anybody who feels like that and wants to talk to direct them in the right direction. But we've run out of time. We will be back next week for our last series, so please come and log on to that. But thank you very much to all our audiences for the comments, for everybody watching, for my guests. Thank you very much for all of you. Thank you very much to Erim for organising this on a week-to-week basis. It's been great. So that's it from us from Eurogench TV. Have a good evening. Goodbye. Thank you.
Bye.
Bye-bye.
Welcome, we are Bologna, calling newlyweds or those looking for a new bedroom set. Venti 5-door bedroom set is not only glamorous and modern, but has storage inside the bed. This bedroom set was £3,700, now £2,395. Bologna, we are here for you.